So the first thing I'm going to do is introduce myself to the patient. I'm going to verify the patient with two identifiers, name and date of birth. I'm going to verify the provider's orders, and I'm going to go ahead and make sure that my patient has privacy. I'm going to go ahead and hand hygiene and get my supplies ready on a clean surface. I'm going to explain to the patient that I will be performing suctioning on her trach today. Make sure that she doesn't have any questions, and also get a verbal consent that it's okay for me to do this procedure. I'm going to set the oxygen flow to the highest level according to the facility's policy, and I'm going to go ahead and auscultate the lungs, and I'll do it on myself. Okay, I'm going to hand hygiene, and I'm going to put on my PPE. I'm going to go ahead and get my supplies together. And I'm going to go ahead and put on my sterile gloves. Okay, with my non-dominant hand, I'm going to make sure that I have my oxygen set at 100 to 120 millimeters per mercury for an adult. And I'm going to go ahead and grab my tubing. If I had a tube to connect to the trach suctioner, then I would go ahead and connect that at this time. So I'm going to go ahead and grab this. And I'm going to lubricate this with my saline. And I'm going to go ahead and insert this into the patient's trach until I meet resistance or until the patient coughs. Okay, so I'm going to go ahead and perform suctioning while removing the tubing, and you want to do it no more than 10 to 15 seconds. Okay, I'm going to go ahead and dip that back in my saline. And I'm going to go ahead and do it one more time. I'm going to go ahead and disconnect this from the suctioning tube and go ahead and discard my tubing. I'm going to remove my gloves. And I'm going to hand hygiene. I'm going to go ahead and clean the dressing from the patient. This patient doesn't have one, but if she did, you will remove the dressing and you want to check the dressing for color, odor, consistency, and amount. I'm going to go ahead and get my things together so I can go ahead and give the patient a new dressing. I'm going to put on my sterile gloves. I'm going to soak my gauze, and I'm also going to soak my cotton stick. And I'm going to go ahead and clean her trach area. You want to make sure you use a circular motion. I'm going to use my cotton applicator for reinforcement, just in case there's any dryness or so if the patient had a locked tube on there, we will remove that tube. We would soak it in our saline. Take the cleaning brush, clean the tubing out, and just depending on your facility's policy, you would either clean it or discard it and get a new one. But if we were cleaning it, you would clean it with this brush, and you would take this and clean the inside of the tubing to dry it out, the bottom and the top. Then you will reinsert the tubing on the patient. And now I'm going to go ahead and give my patient a new dressing. Okay, and the next thing I'm going to do is provide her with a new tie for security. Usually you would double tie this, but this is not long enough to fit around the box, so The proper way to do it is to double loop it, bring it around the patient's neck, making sure it's not too tight and you can fit 2 fingers underneath there, but it's not long enough. But I'll just show you the proper way to do it. Then you would tie it to secure it, and you would go ahead and remove the old security tie off of the patient. And then again, make sure that you can fit 2 fingers length underneath the patient to make sure that she has some room. So I'm going to go ahead and remove my gloves. I'm going to hand hygiene. I'm going to assess my patient's comfort level. I'm going to lower the bed at the lowest position possible. I'm going to go ahead and put the bed rails up, and I'm going to provide my patient with the call light in case she has any questions, and I'm going to make sure that the bed is locked. This completes my trach care.